Okay, so you guys know that comforting sound of when a doctor or a nurse snaps their gloves on. Well, today I want to talk to you about why that snap is actually very important. All jokes aside, the snap is just a sound that we associate the gloves with. Gloves are a precautionary measure for safety, for your safety and for mine. First, let's talk about why gloves matter. Gloves are used in various settings, but in the medical field they are significant. Medical workers need to always ensure proper use of gloves because it is prevalent to their health as well as yours or mine. Wearing gloves in the hospital helps prevent the spread of germs. This helps protect both patients and healthcare workers from infections, states the Medline Plus website. Proper glove application and use can prevent the further spread of infections and diseases from patient to patient. Gloves need to always be disposed of properly and never reused. Gloves should always be turned inside out when you remove them. Gloves should always be deposited in proper waste receptacles as well. Next, let's talk of the different types of gloves in the medical field. The difference glove use has made in our medical field is exceptional, and there are many different kinds. There are various brands, which include generic and brand names, just like anything else. There are various structural differences, such as thicker or thinner gloves for different medical purposes. Thicker gloves are for invasive procedures and help protect medical workers, while thinner gloves are for simple assessment procedures such as taking a temperature, wrapping wounds, etc. Different gloves benefit different needs for workers and patients. There are various sizes for different hands. You would wear a different size than I would, or she may be allergic to powder, she may be allergic to latex, so on and so forth. Therefore, they make powdered, powder-free, latex, latex-free, and all of these are to meet different allergenic patients' needs, or the workers' needs. According to World Health Organization guideline leaflet, medical gloves are defined as disposable gloves used during medical procedures. Also, according to them, exam gloves are used for sterile and non-sterile medical purposes, while surgical gloves that have specific characteristics of thickness, elasticity, and strength are considered sterile. Chemotherapy gloves are strong enough to prevent the chemotherapy drugs from affecting medical personnel. I've discussed glove relevance. Now let's talk about the importance. Glove use is sanitary and can help prevent the spread of germs. According to the Food and Drug Administration website, medical gloves should be used when your hands may touch someone else's body fluids. Obviously, I don't want your fluids on me. That's what gloves are for. Glove use, along with sanitation, can prevent clinic and hospital-related illnesses and even deaths. Wearing gloves in a hospital is important. Just like we package food so it won't spoil, we wear gloves to not spread germs. Overland Park Regional Medical Center staff was sanitary and used proper glove preparations before treatment and delivery of my son. My son was an Overland Park Regional Medical Center NICU patient for the first 4 days of his life, but with the help of proper sanitation and precautionary measures, his health improved and he was able to come home. In 1847, Semmelweis helped decrease maternal mortality rate from 16 to 7% just by implementing hand sanitation. That is another statistic from World Health Organization website. I've discussed the types of gloves and the importance of them and how they benefit community health needs. At some point, everyone will receive health care, and we all want it to be safe and effective. Gloves are a huge part of that care. Always know the snap of the gloves when a nurse or doctor applies them is for your safety as well as the medical workers. It is for good precautionary reason, and gloves may just save a life. Thanks.